Dear learners, welcome to this presentation on therapeutic incompatibility. But before starting with today's presentation, if you have still not subscribed to my YouTube channel, then please subscribe by clicking on subscribe button and press the bell icon to get regular updates. So let us start with today's presentation. After watching this video, the learners will be able to define therapeutic incompatibility, then identify the reasons for therapeutic incompatibility. So, what is actually a therapeutic incompatibility? So, it may be a result of prescribing certain drugs to a patient with the intention to produce a specific degree of pharmacological action. Here, a patient takes a drug to get with the intention to produce a specific pharmacological action, but he will get a different result. Okay, but the nature or intensity of the action produced is different from that intended by the prescriber. So this is known as therapeutic incompatibility. Now, how does this happen? What are the reasons for the therapeutic incompatibility? So let us see which are the reasons of therapeutic incompatibility. First is the error in dosage, and next is wrong dose or dosage form. Then next is the contra-indicated drugs. And next is the synergistic and antagonistic drugs. Then next is the drug interactions. Now let us see each of these reasons in detail. So first is the error in dosage. Now this error may be due to error in writing the prescription or interpreting the prescription. Okay, so most of the serious type of dosage error in dispensing, in dispensing the medication, most of the serious type of dosage error is overdose of medication. So for example, if you look at this prescription which contains atropine sulfate, phenobarbital and aspirin, and you have to prepare the 10 capsules. Okay, so after looking at this prescription, what you can understand, okay, the quantity of atropine sulfate in each capsule is more. Okay, the quantity of atropine sulfate in each capsule is more than its minimum recommended dose. So you cannot you cannot dispense this prescription. Okay, so the prescription is referred back to the prescriber to correct the overdose of atropine sulfate, and then you can dispense this prescription to the patient. After the necessary correction is made in this prescription, you can dispense this prescription to the patient. Otherwise you have to refer back this prescription to the prescriber to correct the overdose of atropine sulfate. So this is the error in dosage. Next is the wrong dose or dosage form. Now certain drugs which have quite similar names, okay, and there is always a danger of dispensing the wrong drug. Say for example, prednisone and prednisolone. These have quite similar name, and during pronunciation you also cannot, you also while pronouncing you feel they are the similar, okay, but they are totally different. And another example is digoxin and digitoxin. So this is the second reason for therapeutic incompatibility, that is wrong dose or dosage form. Then next is the contra-indicated drugs. Here certain drugs that are contraindicated in particular disease or a particular patient who is allergic to it. Say for example, the corticosteroids are contraindicated in patients that are having an active peptic ulcer, or penicillin and sulfa drugs, they are contraindicated to the patients who are allergic to it. So if penicillin or sulfa drugs is given to such a patient who is allergic to it, then he may face serious problems. Okay, so this is the reason for therapeutic incompatibility, that is contraindicated drugs. Now next is the synergistic and antagonistic effect. Many drugs exhibit synergism and antagonism when they are administered in combination. See, for example, if you look at this prescription which contains amphetamine sulfate, ephedrine sulfate and syrup, and you have to make a mixture. So after looking at this prescription, you can see here there is combination of two sympathomimetic drugs. Okay, there is combination of two sympathomimetic drugs with additive effect. So there is need to reduce the dose of each drug. The dose of each drug is need to be reduced. So the prescription should be referred back to the prescriber. So this is the another reason for therapeutic incompatibility, that is synergistic and antagonistic effect. Now next reason is drug interactions. Okay, here the effect of one drug is altered by prior or simultaneous administration of another drug. So what happens here, the effect of one drug is altered by prior or simultaneous administration of another drug. The drug interactions can be usually corrected. Okay, the drug interactions can be usually corrected by proper adjustment of dosage if the suspected interaction is detected. See, for example, if you look at this prescription which contains tetracycline hydrochloride, and you have to send 10 capsules, and see the direction is given, take one capsule every 6 hours with milk. So after looking at this prescription, here as we know milk contains calcium, okay, and tetracycline, it is inactivated by the calcium which is present in milk, but the direction is given as take one capsule every 6 hours with milk, but tetracycline, it is inactivated by calcium which is present in the milk. So in this prescription the therapeutic incompatibility is unintentional. Okay, here in this prescription the therapeutic incompatibility is unintentional, so the prescription should be referred back to the prescriber to change the direction. So this is another reason for therapeutic incompatibility. I hope you have understood what is actually a therapeutic incompatibility and reasons for therapeutic incompatibility. So we have seen the reasons for therapeutic incompatibility, that are error in dosage, wrong dose or dosage form, then contraindicated drugs, then synergistic and antagonistic drugs, and drug interactions. So thank you once again, and if you have still not subscribed to my YouTube channel, then please subscribe by clicking on subscribe button, and don't forget to press the bell icon to get the latest updates. Thank you for your patience listening. Keep learning.